Hey Kickstarter, my name is Adrian Curiel, and I'm raising funds to develop my book in a flash. I wrote this book when I was about 15 years old in the hospital when I was diagnosed with a really rare form of cancer, stage 3, called synovial cell sarcoma.
One book. Everything was written by a doctor. There was a lot of books on breast cancer, pediatric cancer, very few written by doctors and not any written by a child. So when he had his chance to make a wish, he wasn't selfish and he thought of writing a book to inspire others.
I think that first and foremost, this is a first-hand record of a patient's journey through a life-threatening illness and all the suffering and pain of the treatment, the complications that no one else can describe but the patient. And therefore, for anyone, especially other kids who may be going through the same experience, or those who have just finished going through the treatment, this is an invaluable tool to help them bounce back. Just understanding that it's not just them who's going through this. In fact, there's someone else who's gone through this and successfully survived and is doing very well.
It was devastating. It was a shock, and I remember being there and the doctor telling us that he had synovial sarcoma, and when my brother asked what was that, what did it mean, I think my mom and I and my brother, of course, had a feeling. We knew it was cancer. So when he told him, it was hard. It was very difficult to deal with. In a way, it's hope, mental willpower to just get through it, because it is very hard. It changes you. It changes your whole family. It changes your perspective on life. It changes the decisions you make, how little the small things are in life, how you either take them for granted or you really cherish them. It opens your eyes in a way that you basically have to deal with it. But it doesn't always have to be hard or dark. There are going to be hard and dark times, but there is always something to help you deal with it and cope through the situation. And I think this book could help a lot of people out. Definitely.
You know, I don't think it's only, the person with cancer that goes with this, it's the entire family. Everyone's one soul at that point. Everyone's trying to fight it together. And watching my mom and brother, as hurt as they were, it hurt me to see them that way. And I love them, though. I mean, my mother was by my bedside every single time I was in the hospital. There wasn't one time I could say she wasn't there for me. So for that, my family has been amazing, and I love them.
Teenage boy who came in with a diagnosis of synovial sarcoma. He was very much in denial in the beginning, just like all teenagers are. I think they're in shock. I think they have a hard time comprehending that here we've taken their life and turned their normal life upside down, and now you can't go to school, you can't do all the things that a normal teenager would like to do. So I think Adrian, in the beginning steps, had a really hard time, and I think it was his processing that he had to eventually get to on his time, before he could really come to accept what was going on, his treatment, and then come to the decision of writing this book. When Make-A-Wish was presented to him, I think we grappled with lots of different kinds of ideas that lots of teenagers usually have. Usually it's going to Disneyland or, going on some kind of cruise. But I think with what him and I had talked about, there wasn't a book out there that wasn't for teenagers. When he had asked me, is there resources out there for teenagers who have gone through similar experiences, there wasn't any material or resource out there at the time. So I think with talking about possibly having something like a book for teenagers being presented to others who are going through similar situations, whether it's his same diagnosis or any other life-threatening illness, I think he decided to do this book and write his personal experiences while he was in treatment, which I think was very helpful for him. I think it was able to help him process. It was able to provide a lot of insight within himself to be able to...
From the point of view of healthcare providers, it is also something that is eye-opening, because we always address our patients as someone who is separate from us. But here we are hearing first-hand report of exactly what the experience is all about and how we need to work with them very closely so that it becomes more tolerable, and also to understand what it is actually that they're going through. We always say we understand what you're going through, but we actually don't. And now we have the opportunity to read this from someone who has gone through and has actually had personal relationship with us, especially me being the physician who has ordered this regimen, all the chemotherapy and radiation for Adrian.
Thank you everyone for watching my video on Kickstarter.com. Your donations are going to make such a huge impact, and it's all because of you guys, so thank you so much. For donations over $20, I'm going to be making this very cool yellow bracelet with a silver charm. The yellow is going to represent pediatric cancer, and then the silver charm is going to have a camera because it's going to represent In a Flash the book. Thank you guys so much for watching my video, and I appreciate everyone. Thank you.